What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. Today's video, we're covering what the difference of being an X-ray tech versus a nurse in the main radiology department. I know what you're saying. You're like, Miguel, nurses are in our department? Yes, they are. Not in X-ray in particular, but in radiology as a whole, we do have nurses who work within our field very closely, but they're more in different modalities. So once again, I have this knowledge based off of my lady who is a nurse, and I am an X-ray tech, so I have a good amount of knowledge in both worlds. So to give you context, I work night shift and I also work day shift a lot because I work a lot of overtime. So I would say when you're in the radiology field, majority of the stress and workflow will be more heavily on us, the techs. The nurses are, it all depends on which modality, because I've seen IR and cath lab, certain ones, the nurses are more heavily involved versus, I know cath lab, the X-ray techs are more heavily in charge and stuff. So to give you context, I would say that mainly the main role of the tech is, like in IR, is to look over what's happening, inform the radiologist or RPA of what's going on, talk to the patient, let them know, hey, we're going to do this, do that, and actually be more actually doing the procedure. And the nurses who work within our field, usually their duty majority of the time is to get the patient ready as far as like dressing them, gowning them, and having them in the waiting room type with little holding room. That's kind of what they deal with. And all the meds and allergies and payment and stuff, they will help us, acquire those and administer those. And then post, usually they help post operation or whatever they get done. They'll help take the patient back, get them ready, give them the whole summary of what they got to do and recovery and all that. That's kind of what they deal with, so it's slightly more easier over there. And then there's certain fields where it's modalities where they're both intertwined, where at the same time the patient's asleep, you have even people, the CRNA, who they're working with you, and it's more of a team unit where both the X-ray tech and the nurses are both in the battlefield actually doing stuff with the patient and helping and getting the what's it called, the little hooks and it's mainly for cath lab, the Jews, I forgot what they're called, but the stents and stuff, and it'll be more invasive, and the nurses are documenting what stuff we're using and how long they're asleep, and it gets more intertwined, and it's more of a team, and they do more stuff. So yeah, it's been your boy Miguel. See you on the next one.